what I call a target squat. That's where you sit back to touch your butt on a chair seat. We looked at potentially adding weight to that. You could use something like a heavy book, or you could hold a dumbbell in 2 hands, or you can hold a kettlebell in 2 hands. Anytime we add weight in the front, it gives us a counterbalance to control sitting back. Okay, so everybody just do like a few kind of easy warm-up squats. Get into your body, see how this feels. Weight is optional. If you're not using a weight, I would suggest reaching your arms forward in transition. So as my butt's going back, my arms are going forward to counterbalance. And then as my butt comes forward, as I come upright, I can bring the hands in towards center. I want to give you a couple of options that take you through a lower squat. Here's something that's a little tricky with the knees. Knees, if you have pain in the front of the knee, around the kneecap, which a lot of people do, like going downstairs or squatting, that pain sometimes is worse, the worst, when the knee is bent 90 degrees. And the reason for that is that when the knee is bent at 90 degrees, the kneecap has maximum contact with the femur bone, the thigh bone behind it. When the knee is completely straight, the kneecap has very little contact with the bones behind and can kind of wiggle around, just kind of free floating and tendon and can move around and is usually in a more comfortable position, right? If any of you have ever experienced sitting for a long period of time, clinically, this is called moviegoer's sign, because if you sit in a movie for 2 hours, or these days, I don't know, there's like 3-hour movies now. I don't know when this trend began, but for a very long time, sitting in a movie, your knee, or on a plane, your knee's gonna be bent about 90 degrees that whole time. And for some people, that can get really irritating in the knee. And you might, if you've ever felt this, you might feel like you wanna stretch your knee straight for relief, right? Because it then puts the kneecap in a position where it's not pushing against the structures behind it as much. There's a fat pad there behind the kneecap. It's a place that those fat tissues can hold a lot of like inflammatory chemicals and get really inflamed really easily. So kind of a hot spot around the kneecap for knee irritation. What that means with squatting is that if you have pain in your knees, in the fronts of your knees at about a 90-degree bend, this kind of squat might not be so great, because you're going to about a 90-degree bend at the bottom where you're putting kind of the most force through your knees. It seems counterintuitive, but if you can squat down lower than that, you reach a point beyond 90 degrees where it can feel better. So some people have what's called a painful arc, where it's like, it's fine, it's fine, it's fine. Ow, right there, it hurts. And then, oh, it feels totally fine, totally good, all the way down here. Because when the knee is flexed this much, again, the kneecap doesn't have that much contact with the bone behind it. And then on the way up, it might be like, I'm good, I'm good. Ooh, right about there, it hurts for like a portion of that motion. So I want to show you a couple of ways that you can work with kind of more accessible movement through a full range of motion in a squat. And what's great about these options too is it makes it a little easier on the hip. If your hip happens to feel tight, tender, pinchy, kind of compressive in a deep hip hinge, these options are going to offload stress from the hip. Okay, so one option, and you can use like a folded up blanket or a folded up towel for this, or you could fold over a yoga mat. If you're using a yoga mat, one option is to create a little bit of higher surface to put your heels on. And what that allows you to do is stay more vertical with the torso, which makes it a little easier to go lower. I invite you to try this, but if it feels not accessible today, don't worry about it. Again, some of this might be a like, try it on today, maybe it's a save for later. Bonus is if you add a weight in the front and have your heels lifted, it makes it much easier to stay very upright through your trunk as you sit down. So this is going to make it not such a deep hinge in your hip because your torso is not hinging forward so much. And it might allow you to get into a much deeper squat position, potentially. You don't have to have a squat rack for this, okay? I'm actually going to lower this bar a little. I have patients and students who do this kind of squat on their deck or on their porch, because decks and porches often have a railing of some kind with like upright railings as well. And just make sure it's very sturdy, right? I don't want you to like lean into this with your body weight and pull a chunk of wood off your deck railing, right? Make sure you have a really sturdy railing, or like a metal staircase railing where you're on a landing, so you're not near any stairs, right? Be safe, be on a flat surface. But what you can do is hold on either to the top of the railing to squat. Like that felt so easy because my arms are supporting me and offloading a little bit of my body weight. I go like that and use my arms to help me move through that, help me get back up. And if I was not holding on to this, I would fall over backwards, right? I cannot squat like this without holding on. Yeah. And I see, Kate, you've got like the upright of a squat rack, and upright works well too. So if I was going to grab onto like an upright slat on a railing, you could do this, and you can hold a vertical railing to get down low into your squat. You could even walk your hands down lower and walk your hands up so that that upright supports your body weight.